The call to the member for Fowler.
Thank you, Speaker. My question is to the Prime Minister. Prime Minister, I welcome your record Medicare spend, having long called for expanded bulk billing access. But with mental health the #1 reason people visit a GP in Fowler, doctors tell me that cutting Medicare items 2712 and 2713 removes the flexibility to provide longer, meaningful consultations for complex mental health cases. Can you guarantee that cutting items 2712 and 2713 won't deter GPs from offering the mental health care that families in Western Sydney depend on?
Call to the Minister for Health, the Minister for the National Disability Insurance Scheme.
Thank you, Speaker, and thank you to the Prime Minister for giving me the opportunity to respond to that. I haven't had a conversation with the member over the last several days, but I'm very pleased to report to the member and to the House that, as far as I can tell, every single general practice clinic in the member's electorate has indicated that, as a result of our investment on Saturday, they will all be 100% bulk billing. Every single GP clinic in the electorate of Fowler.
Order. The Minister was talking about Medicare, but I'll listen to the member for Fowler on a point of order.
Thank you, Speaker. It was very specific, asking if the Minister of the Government will guarantee the cutting items 2712 and 2713. I understand that Medicare spend, I know that that's what the government has been talking about, that you spent millions, 8.5, but I'm asking specifically 2712 and 2713.
Yeah. The member for Solomon is warned. The Leader of the House.
Speaker, just to the point of order, there's a practice that's developed in points of order on relevance where people consistently quote only a small part of a longer question, and you have given ruling after ruling making clear that the relevance rule applies to any part of the question, and if people don't want there to be parts of the question that deal with anything other than their final few words, they should only ask the final few words.
Yeah, it places me in a difficult position when you ask a question about Medicare and you include things. That's okay. Resume your seat, Member Fowler. And then the Minister is referring to that part. Now, he's 2 minutes 29 to go. He may be going to address that part of the question. I don't know. Right? Order. He may be focusing on that part, but we've only got one shot at taking a point of order on relevance. And I'll just remind members, probably it's best to keep that at the end, because once that's gone, it's gone. And it's very difficult now because I don't know what the Minister is going to refer to in terms of mental health. He may do that, but I understand your point. You'd like an answer specifically regarding that end part of the question, but understanding rule is he's entitled to talk about the question that he was asked about. So anyway, I'll listen carefully and I'll make sure he is being directly relevant, and I'll make sure he continues to be directly relevant. The Minister has the call.
Thank you, Speaker. I must say I'm a little surprised at the member's minimisation of the impact of the biggest ever investment in bulk billing in her electorate, given that, as far as I can tell, no electorate represented in this place has got the sort of result that I just reported has come from Fowler. And the relevance of that is that if you read the annual report from the College of GPs, increasingly they say the #1 issue that GPs are consulted about 70% of GPs report this, I think, the #1 issue they are consulted about is mental health. It is their bread and butter work, and the affordability of access to GPs is more important for mental health support than probably any other condition we can think of. So I'm surprised, frankly, that the member would minimise the impact of the record investment that we rolled out on Saturday for the access and affordability of mental health support in GPs. That was one of the overriding priorities when we designed the system that we rolled out on Saturday. So what I can tell the member for Fowler is that constituents in her electorate will have more affordable access to mental health support from their GP than in any other electorate represented in this chamber.
Call to the